Hello, and welcome to our third in a series of podcasts reviewing chapters 1 and 2 here during our first week. So what I wanted to do was just briefly go over some of the main ideas from chapter 1. Remember, what we've been trying to do is work on our definition of assessment, and so we think about how assessment is from a broader picture, that it is a process of gathering information. You create an assessment system with its own organizing and nature. We should understand that we interpret assessment data after the fact. It's very normal for us to want to try to interpret as we assess, and that's pretty good. But when you also use several forms of evidence, you'll want to be more purposeful in your interpretations of assessment data. And remember that any tool, any form of assessment that you use to measure physical, social, emotional, cognitive development, that anything that you use is used to make educational decisions, right? So assessment drives instruction. That's our typical go-to, right? Remember that there were several forms, several purposes in assessment. We've talked about screening and eligibility, determination for diagnosis. So screening is kind of a broad swath of understanding of where a child is in reading, for example. If we see from a screener that a child has an issue in a particular area, for example, phonetics, whatever that might look like, then we might use a diagnostic measure to help understand where in phonetics that the child is having a problem. So screening helps us lead to diagnostic measures to help us for a diagnosis. Early childhood intervention is key, right? So and it makes the most difference. So developing individualized programs, IEPs, IFSPs, so forth, very early on is really important. Assessment in early childhood also helps us progress monitor toward goals. So you'll see most of the time that major screening instruments are used at least 3 times a year. We'll talk more about that in a minute. We use assessment for program planning, evaluation, and of course research. And I think I touched enough on that earlier. The book does talk a little bit about assessing students with disabilities, and I wanted to just mention 3 important ideas about assessing students with disabilities. This isn't the special education course, so we don't have that main focus. However, when you screen for all of your students, of course you might have some inclinations, and especially as you work more with students throughout the year, you might have some inclinations that the child may be in need of some special services. So the idea is that after a screening measure that the entire class might use, then you might go, if you have concerns in specific areas, you might go to a diagnostic measure to help get the child services. So a diagnostic measure typically is given by a school psychologist. You may work with a school psychologist in giving this measure, or you may have some input into this measure depending upon what you're measuring. However, it is very important that the child have at least 2 diagnostic measures. So we're using multiple assessments here to look at the same thing. We want to make sure we're using reliable assessments. We'll talk more about that when we get to actual testing, and that won't be until midway through the semester. We also want assessment tools that are unbiased, and that becomes really, really difficult when we talk about things like socioeconomic status and language issues. So there's some really important nuances to this, and we can talk about them here, or you can talk about them in your other class as well. But I just wanted to mention those 3 ideas. So if you're giving any sort of, whether it be a screening measure or a diagnostic measure, typically screening measures, so you might see, for example, the AIR tests, the, even if it's Dibbles or Ames Web, any of the CBMs that we're going to be talking about later on in this semester, map testing, all of those, you want to make sure you follow the guidelines to a T. So there are certain permissions you got to get from the parents. You have to have all your materials out and ready to go. You have to make sure you're in a familiar environment with the child. One really, really important thing to mention is that you want to build rapport with the child. Make sure that you're not just like jumping in, come on, you got to take this test type of thing, right? Make sure you're using your assessment time efficiently. If the child's starting to tire out, take a break, let them get up, stretch, go for water, whatever it is. And don't forget to think about the adaptations that you might be able to use. But those two pieces that I bold here, building rapport with the child and using your time efficiently, watching out for those signs of fatigue, those are the two main really important pieces when working with young children and giving them standardized tests. Okay, we will go to this again and again and again. You should never give a test. So we've been talking about testing. But you should never give any sort of assessment if you're not going to use the assessment, right? If you're giving an assessment just to get a number in your grade book or whatever it might be, then that's the wrong purpose, right? So purposeful assessment drives meaningful instruction, and that's exactly where our mindset needs to be, that everything that we're doing in a classroom has purpose, and that what we are doing is meaningful instruction. Okay, so these are some of the things. I believe this is from chapter 1 into chapter 2. So what Wortham talks about in here is the three different areas of testing. So you want to think about pre-tests, right? Pre-assessments. We're going to harp on this a whole lot this semester. So in fact, you'll see some times when pre-test, so if assessment drives instruction, which it does, then you have to pre-test to find out what children know about the content or what skills they have that you have to teach, right? This is also how you help plan for differentiating instruction. If you know where the children are, then you can plan your instruction. So when I mentioned BOY or beginning of the year, in kindergarten this might look like the KRA. Used to be the KRAL or S and all these other things, but the KRA is now the big thing, the Kindergarten Readiness Assessment, and we'll talk more about that throughout the year here. MAP testing, or the MPG, which is the map for primary grades. So you're going to see all of your CBMs 3 times a year at least, and that goes in all of the grades, right? Third grade is a little bit different because you have the AIR, the third grade reading guarantee test. So you're going to also add in that. Those are the standard assessments within Ohio, at least. There's also ongoing assessment. So the idea that you create units, right? You create units of learning. You follow maybe some sort of pacing guide. You work within the pacing guide, moving things around as needed, as to fit the needs of your students, right? Keeping track of where they are. CBMs or curriculum-based measures we'll talk more about, but as I've already mentioned a couple times, those come out 3 times a year, right? So beginning of the year, MOY, middle of the year, and then also EOY, or end of the year, right? And so you have to be able to show growth. It's been put to me this way many different times. So we as teachers, we can focus on just achievement, right? So we can just focus on those end of the year results and say, here's where the children are, right? In most cases, that's fine, right? So if you're in suburbia or private schools, wherever the kids end up at the end, usually tends to work out, right? But in most public schools today, what we really need to focus on is progress. And so teachers are measured according to the progress that children make. So a C or B level teacher makes about a year's worth of progress for a child. So if a child comes in first grade, first month, they leave your class at first grade, 12th month, they've made a year's worth of progress, or second grade, first month, whatever that looks like. So 12 months worth of progress, right? According to the CBMs, according to the tests. That's a C, that's an average teacher, right? So in order for a teacher to be considered an A-level teacher, right? Superstar teacher, you have to help children make 2 years worth of growth, every grade level. Pretty difficult to do, right? So it's just something to think about it as we're in this era of accountability, and we're in this era of measuring the work that teachers are doing with students. That 1 to 2 years worth of growth makes a big difference when you think about how a teacher kind of views themselves, right? Teacher efficacy at some level. So just something to think about as we move forward. There's only 1 or 2 slides here to wrap up from chapter 2. We talk about, well, the chapter focuses on, what early childhood assessment should be. And so it's all the things that we've been talking about as far as what makes good assessment. Multiple sources of information about the child in that particular domain. Everything that we do, the assessment tools we use help us create meaningful learning opportunities. Good assessment should be easily translated for the family. It should be easily translated to the children. Children should be able to receive feedback. We're going to talk a lot about feedback throughout the course of our time together, and they should be able to use that feedback to improve their own learning. So when we talk about things like self-regulated learning, right, feedback plays an integral role in that process. Assessment should be ongoing, strategic, purposeful. Good teachers are assessing all the time. They're figuring out what's happening with each child within groups, individually, and so forth, right? And so that's another piece of it, right? To start to think about, okay, so I should be able to assess each individual child, but I also need to assess groups of children as well to see how children do in those groups. And so the last point there talks about setting goals, right? So every child should have those goals that are set for them, and those can come from the pre-assessments, right? So if you know where the child is, you're starting to get an understanding of who the child is and their focus, but it's also really important that you talk with the child about setting goals for themselves and seeing where they can go to kind of to push themselves and be able to accomplish something positive within school. We have a little bit of work to do on the NACCE position statement on pages 33, 34 of your book. I've outlined that within the module. Basically, your idea here is you need to translate these into tweets, something very simple, but make it simple. Make it simple. Try not to use all of the big words that they use. Let's translate this for parents, right? When you think about how children should be assessed, how can you make it just understandable to anybody on the street? So there's a little bit of homework with that. I'd also like you to read Chapter 5 and do a little bit of homework for that. So in Chapter 2, they talk about different forms of assessment, different pieces of assessment. These are there's a lot of overlap between Chapter 5 and Chapter 2 as far as documentation and starting this idea of documentation. So I'd like you to get a head start on Chapter 5, a little bit of homework with that. You're creating some squares and there's some options there for you. So it's a very short chapter as well, so you'll be able to work through that. I promised myself 15 minutes here. I'm right on time, so I'm going to stop. But thanks again for watching, and keep reflecting, and look forward to seeing you on Monday.